Sure. I think that we've got to start with the different levels of intervention, but I think to me, nutrition always needs to be assessed as a part of an integrative oncology plan. And quite often people might come and talk to their doctor or other healthcare professional about it. And everybody's so afraid to give advice on this. Sometimes you end up getting no advice or being told nutrition doesn't matter. And the research very much contradicts that, and research really, really does matter. In fact, the World Cancer Research Fund has produced massive reports on the role of nutrition lifestyle in cancer prevention. So just by going to their website and reading their report, you can think about some of the really important things, such as, minimizing alcohol and sugar-sweetened drinks, eating whole foods versus processed foods, making sure we're getting enough dietary fiber through a wide variety of different plant foods, minimizing processed meat or avoiding it ideally altogether. So there's a number of different interventions within that plan that can be printed out off the website and that people can counsel their patients around. And I think that's a baseline intervention. And really, if everybody received that, I would already be quite happy. But actually, this is not the advice that people get. Quite often on the chemo unit, you might say, get something like, eat a cream bun because you're hungry or you're going to be a bit tired, treat yourself with a biscuit. And actually, there is no good evidence for that, unfortunately. In fact, the evidence is very much to the contrary, that high sugar, more pro-inflammatory foods are associated with worse clinical outcomes for both people in treatment, but also cancer survivors. So focusing on a whole food-based anti-inflammatory diet that is really avoiding some of those processed foods and harmful substances such as alcohol is going to be a really important intervention. There's a second level to that, and the second level is really personalized intervention. So when we get into trickier situations with patients where there might be gastrointestinal symptoms, they might be losing weight or have gained weight significantly on chemotherapy, they might have rising inflammatory markers. Some of those things require more general lifestyle counseling. And at that point, you really need a personalized nutrition plan. That also takes into account what other treatment they're on, because our nutritional needs change from perioperative management, what you need to do before and after surgery, to radiotherapy, to chemotherapy, to survivorship, or living well with metastatic cancer. All of these phases have actually different requirements and different nutrient needs. So at that point, when we're trying to intensively support someone who's really struggling, then you really need a personalized plan based on that. And of course, the gut microbiome is another big area that, again, I could probably spend hours talking about. And that also influences the way we respond to some of the newer cancer drugs, such as immunotherapies. And I think many people will be familiar with a study that came out around melanoma and immunotherapy, and how just getting enough fiber compared to not getting enough fiber has actually changed someone's clinical outcomes within a trial. So some of those things, they're not rocket science. I'm not saying they are rocket science, but actually it's really important to be consistent about it, and to also not be afraid to come out and say, no, probably a biscuit isn't the best thing for a cancer patient, but something that's got color, something that's anti-inflammatory, something that's got a good protein, fat, and healthy carbohydrate balance is going to be probably a much more optimal way to eat. So that's just my thoughts on that.